Hi, everyone. Thank you for joining us this afternoon for Is Your Website Causing Your Brand to Suffer? My name is Laura Clemmons, and I'll be going over some housekeeping items before we begin the presentation. If you'd like to ask a question, then please use the toolbox on the right side of the screen. And due to the size of the audience, attendees will be in listen-only mode to cut down on background noises. And there will also be a short 7-question survey after the webinar, and we would really appreciate your feedback. I'd like to welcome our panelists today, moderator Lauren Minors, the Director of Partnerships and Marketing for Reason 1, Stephanie Pierce, the VP of Strategic Marketing for Arkansas Children's, Mickey Wildt, the Associate Director of Client Engagement at Core Health, and Joel Cessna, the Vice President of Sales for Erupt. Lauren, I'd like to go ahead and hand it over to you.
Sure. Thanks so much, Laura. Welcome, everybody. Thank you so much for joining us today and spending some time. I'm really excited to be moderating this panel of incredible experts talking about how Arkansas Children's, how Stephanie Pierce has coordinated a really deep brand care team for Arkansas Children. So just to kind of get us started, coordinating with multiple partners can sound kind of daunting, right? Several different contracts, workflows, collaboration tools, billing, all of that kind of stuff. Everybody has a slightly different way of working. It sounds really complex and potentially somewhat expensive, but what Arkansas Children's has been able to do is that by intentionally coordinating a team of best-in-class experts, bringing them all to the table at once, they have been able to create a nimble and scalable approach to all of the different projects or campaigns that they have going on at any given time. And so we're just going to talk through their process and show an example of how all of this kind of comes together in theory, and then also how it manifests for a really successful campaign that they were able to execute. So just to get started, Steph, I'd like to start with you. Can you tell us just a little bit about where your background was in your journey to Arkansas Children's, and then sort of where you were and what was the state of vendor relationships when you started?
Absolutely. Thanks, Lauren. So as Lauren said, when I started out in Arkansas Children's 5 years ago, I actually came from telecommunications. So I was from out of industry, as we would say now, with our healthcare marketing friends. Had a lot of experience with e-commerce and digital marketing strategies in a for-profit setting. So I came to Arkansas Children's around 5 years ago. When I got here, we did not have an agency of record, which I was very used to working out of industry. And, for that matter, we didn't really have a lot of strategic partnerships. We had a few agencies that we'd work with on specific campaigns. So if we were doing a service line campaign, we might use one agency for that entire campaign, no matter what their strengths were. So even if they were really strong in brand, not so strong in digital, we would still use them for everything. And so what we figured out from that, obviously, was there was not a lot of benefit we were getting from using a quote unquote agency of record, using it like that, because there wasn't specialization in what they did with certain arms of our media mix. So at the same time that was happening, our team was also experiencing a lot of change and growth. We were growing from one large marketing and comm shop to a specialized strategic marketing team. We were making sure to hire subject matter experts over digital, traditional, content, and brand. So it would have been very easy for us to continue a siloed approach of saying, okay, subject matter expert over digital, you go find just your digital agency, traditional, go find your own agency, all of that. But what we really wanted to do in our first couple of years of getting our team operationalized was really figure out how can we take our team of experts, whether they're in digital, traditional, content, whatever that looks like, make sure we get them all to the table to work effectively together. So, our team, like I'm sure many of you on this call at the time, and I would say still, we're experiencing a lot of challenges. Budget constraints, right? Always making sure that we're fiscally responsible. And as Lauren said earlier, sometimes when you have multiple agencies, that can mean more dollars spent. And so really trying to be effective on how we were scaling up and scaling down, depending on state of the business, the particular service we were trying to market, and what specialization we needed for a given campaign. And then with the complexity of healthcare, we really knew, again, that we needed agencies that specialize in each arm of our media mix. So making sure, and Joel and Mickey are part of our team, making sure that we had digital experts at the table, we had brand experts at the table to really guide those specific pieces of what we were trying to accomplish. And then I'd say, Lauren, the last thing that really our team was experiencing at the time was we were very much playing catch up when it came to digital transformation. So I think we're in a lot better place now than we were then. But at the time, we were at this place where we were changing our team quite a bit. We were trying to build that internal skill set of what it meant to have a digital front door, have multiple digital front doors, and make sure that our team really knew things like web personalization and how to build those things out in a world they'd never done that stuff in. And so we were building that internal skill set. And so we knew it was really important to make sure that we had partners at the table who are subject matter experts in some of those areas and could help not only guide our strategy externally, but make sure that our team was educated internally as well.
I want to touch on that just really quickly about the balance of building the skill set internally, but also knowing that there is someone who does, whatever that discipline is, day in and day out to guide that. Can you talk just a little bit more about like how those relationships built, or are we getting ahead of ourselves maybe?
Yep. But no, it's a great question. So something that we've leaned on, and I'll use an example of our web partner content strategy on our web. Something we've done with them is we actually, in the early stages of replatforming our website, we actually had them train our team on the new system, right? So we took a system, we implemented it, but then obviously, as you guys know, there's a lot of customization and build that goes with that, specific to your instance and what you're trying to accomplish. So we actually leaned on our web agency at that time to help do trainings for our team. And they were things like how to do basic personalization 101 on the website, right? And we went through journey mapping and audience mapping sessions where we would say, what are our primary audiences? Let's look at the data. Let's pull some survey information. But then let's also see how we implement that from a functional standpoint. So we actually, it was one of the things actually as we were looking for web agencies that we made almost a requirement of our RFP process, is we said we need somebody who will facilitate ongoing training for our team on not only the platform, but on best practices from a digital transformation standpoint.
That is so key. I really want to highlight that, making that a part of your RFP and knowing that when you're building these relationships with whatever your partnership mix happens to be, knowing that they're going to be a continuous partner, not somebody who's going to check a box, complete their project or task or whatever, and then they're off to the next thing. Because to your point, like, you can only scale up your internal team to a point because they have other stuff to do, they have other priorities, and someone else needs to be there to be their shepherd.
Absolutely.
Yeah, so going to the shepherd side, for Joel and Mickey, let's talk about where you all were in the mix here. So as partners with all of this deep specific expertise, like, what is the working relationship that you are usually exposed to when you're thrown into the mix of a team like this? How does it usually feel?
Yeah, I'll go first, Mickey. I mean, typically, a lot of times we're not really even exposed to the other partners that are working on projects, and really, it makes our job more difficult. And at the end of the day, it's making the finished campaign and the product not as successful as it could be. Trusting your partners that you're choosing, that you're bringing to the table, allow them to collaborate, like Arkansas Children's did, just makes that campaign more effective. It makes unified messaging. But typically when we're brought to the table, we might hear some of the other companies they're working with, but I think there's kind of that stigma or that fear that there's going to be some fighting going on between the two or between the multiple organizations in many cases, when I think deep down, all of us want to really be collaborative with one another.
Yeah, thanks, Joel. And I think too, there's a little bit of truth to that stigma about some infighting between organizations sometimes. Everyone's trying to protect their piece of the pie and they don't want someone else taking it. That's where having a client inside who sets the tone for what that kind of cultural relationship between client and vendor and partner and in between partners themselves is so important. You know, we have this kind of culture of shared responsibility within the Arkansas Children's ecosystem, the partner ecosystem. So that type of behavior just it's not allowed and it's not supported. And, you know, should someone come into the ecosystem that behaves in that way, I think the rest of us as partners know that Stephanie and her team are going to moderate that kind of behavior and prevent it from happening, because it impinges on all of our ability to do the best possible work.
Yeah. I mean, it's like an adversarial relationship would be kind of the worst case scenario. But I think, at least from our perspective, sometimes we get thrown in the mix and it's just like, you know, we're missing information. There's things get tossed over the fence when we're not coordinating directly with other partners. And that just creates knowledge gaps and, you know, really, you know, missed opportunities for collaboration and a little bit better product or a much better product without having those conversations and understanding where each other's strengths are coming from and knowing that you can really lean on each other, all in the service of the client. So just switching gears a little bit, Steph, if you would, you brought everybody to the table for strategic planning to mend those gaps, to eliminate them, make sure everybody was having the conversations. Can you talk a little bit about kind of how that all came together and what the process was and what that meeting was like?
Sure. So we were, you know, I would say we were in a downhill slump with COVID, right? And we were having a time period where we were thinking, you know, it's been at this point a couple of years since we've seen a lot of our extended team members in person, and frankly, a lot of them had not met each other or been in the same room. And so I guess it was the summer of last year, 2022, we decided, you know what, we need a strategy session where we bring all of them together, and we invited our chief strategy officer, who is my direct leader, as well as our director of growth initiatives, who really oversees our business development, and our physician liaison. So we brought sort of all these people together that are focused on growth and strategy, and then along with all of our partners, our key partners, some of which you see here on the screen. So we brought them all together for a 1.5-day session in person. We did have some virtual because, as COVID would have it, we planned it in person, and then it got a little crazy as we got closer to the in-person event. But it was still great. I mean, it was a hybrid virtual in-person. But the 1.5 days that we spent together, really the purpose of that was for our team to know where we're headed as an organization from a strategic plan standpoint and where our specific marketing team fits into that overall plan. So I will, I know some of you on this call have heard me say this, but you know, Arkansas Children's is a place where we do build a 5-year strategic plan, and it is the first place I have worked where that plan is a living, breathing document, not something that sits on a shelf and you review when you onboard and never look at again. And so everything that we do, from even a tactical marketing scorecard planning standpoint, you know, saying we're going to drive X number of leads, or we're going to open a particular clinic and market it, to things like how we're going to plan a campaign, a big brand campaign with maybe Mickey and his team, right? All of those things ladder up to a strategic plan. And so for us, it was really important to start that time together with our partners by having our chief strategy officer go through sort of a state of the union, if you will, on where we had been on the strategic plan. At that point, we were in, I believe it was year 2. So, you know, looking at, okay, where have we been? What did we do that we said we were going to do? And then where are we going as we move into year 3? And then the back half of the day, we laddered in then how our strategic marketing plans rolled up to that overall strategic plan for the health system. So it was a really cool way for us to kind of, again, for the team to see where are we going organizationally, even if it's stuff that marketing doesn't directly touch or impact right away, but then also how do our marketing plans layer in with that? You know, at the end of the day, if our partners don't have that information and know what goals we're trying to accomplish, we're not going to be successful as a team. So I think it was really important for us to make sure they knew what are our marketing goals for the year, how many leads are we going to drive, how many appointments do we ultimately want to get, what is our brand strategy going to look like? All of those things that go into that is really important for us to have that time together. And then the second day, we broke out into smaller groups and had some individual team conversations around a digital space, a content space, and a brand space. So it was just a good time for us to, you know, network, kind of see each other, but also to get a lot of learnings out of our fiscal year planning as far as how we work best going forward.
Yeah, I love this approach, and I hope that if if folks take nothing away from this discussion today, it's this as a really, I don't want to use the word easy, but simplified way of breaking down multiple silos at once, right? So you're like breaking down silos between your team and your partners, breaking down silos between partners. I love the idea of having those second breakouts with that's like working on this campaign, digital or whatever, because then you have, you know, perhaps members of your internal team that know, you know, Erupter or Core or whomever as, well, these are the folks that we call for this, but then they get the breadth and the depth of their experience and really understand like how they can be more of a one-on-one partner as well as a holistic partner for the entire strategic plan. I mean, there's lots of layers of connectivity there that are just, you can't pay for that. It's extremely valuable. Right.
Absolutely. And we're even thinking about this year, you know, we're going to do it this year again. And we even talked about inviting our entire marketing team to part of the day so that they can hear what all of our partners do. You know, the leadership team works directly with these partners a lot, but a lot of times our individual contributors don't necessarily get to interface a lot. And so we really want them to have time, whether it's for half the day or something like that, to interface. And to your point, get to know our partners, get to know sort of the people behind the curtain sometimes that help us be successful. So we're really excited about this year too.
Yeah, I love that, especially bringing in the individual contributors, having been in that role before. Sometimes you just get handed that strategic plan and you're kind of like, okay, well, how do I see myself fitting into all of this? How am I contributing? What's my role? What's my spot? And so you're gifting them that as well as all of the other stuff. That's awesome. So let's talk a little bit about how this really manifests into, you know, not just a silo breaking exercise, but how it kind of shows up in a work product. So model in action, the vaccine campaign. I'm just going to toss this out to whoever wants to start with this example.
Oh, Mickey, you may kind of tee it up and then I'll let you kind of talk about the campaign creation.
Yeah, sounds good.
Okay. So Lauren, we were summer of 2021, you know, I think it was Delta, I guess if I'm keeping all my variants straight. Delta had just started surging again, and we were at a place, you know, especially here in Arkansas, we were at a place where it was starting to affect kids in a different way than it had before. And so as the only pediatric health system in the state, we knew we had a role to play in sort of a PSA campaign to make sure that parents, caregivers, in this time of uncertainty and, you know, not really knowing where to go for a source of truth on information regarding vaccines, especially the COVID vaccine, we knew that we had a spot to fill and that we had to do it very quickly. And so we engaged Mickey and his team. We were having ongoing conversations at the time about just, you know, the state of COVID and where we were as an organization, as a state, as a country. And so it was a really great time for us to engage the core team for some quick help on, you know, still making sure it was research informed, but making sure we moved very quickly to get some stuff in market within really a matter of, I think it was 60 days or so. So Mickey, I'll let you maybe talk about some specifics.
Yeah, those 60 days felt like a little bit longer than 60 days when we were working through all of it together, but it definitely was a quick turnaround. I think, you know, as Arkansas's brand partners, we were keenly interested in and concerned with the way that we would approach this conversation with folks. You know, it was a very polarizing topic around the idea of vaccination to begin with, but then when you start to bring in the idea of vaccinating kids, it becomes an even more nuanced conversation. So that the research that we did in short order helped yield some insights for us about how to go about having that conversation with parents of kids who were now eligible for vaccination and for the parents of kids who are going to become eligible for vaccination in the near future. And that yielded a creative approach for that campaign that was very different than what we were seeing from healthcare systems around the country at that time. Instead of you know, really pushing people and asking and pleading with them to get vaccinated and get their kids vaccinated, we opened up a dialogue. We highlighted real Arkansas children's providers who were parents of children in the market that we were talking to, encouraging them to reach out, have a conversation, learn more about it. further highlighting kind of the brand ethos of Arkansas Children's as an organization, that they're really here for both the children and the parents of children in Arkansas so that they can deliver that unprecedented health. That then turned into an overall campaign strategy, which we ran traditional media. There was a digital media component, which was a good point where kind of Stephanie started serving as that quarterback for us and with all of the other partners that they have on a digital media front, including Joel and his team, so that we could extend the impact of the campaign in a multimedia manner.
Yeah, Joel, if you would like to elaborate a little bit on what Erupt's role was in all of this.
Yeah, so it's really taking the overall objective, like Steph and her team had highlighted right away, working with CORE on the approach that they took. Obviously, a very thoughtful, very impactful approach. And then for us, it's taking that and making sure that we have that same messaging in our campaign tactics around paid search, and making sure that that messaging, the ad copy, different keywords that we're targeting really is synced with the other marketing efforts that CORE had in the market. So really making it look like it's a truly unified approach to the consumer that's online, that they're searching for vaccinations, different COVID searches, things like that. So I mean, as far as the campaign goes, you can see the impact that it had from an awareness perspective right off the bat, with over 100 million impressions across both traditional and digital channels. Content definitely had a lot of engagement around that, with a huge increase of calls to Arkansas Children's. And then also strictly from a paid search perspective, over 4,800 visits in that 3-month flight for people that could learn more. They could schedule an appointment for a vaccination. Over 200 people actually picked up the phone and called. And these were qualified patients that were calling. So when you actually look at what that cost per lead was, is right around $7 with their marketing efforts in paid search.
Wow, that's really impressive.
I think something that Joel mentioned is a good opportunity to highlight, like tactically, how this type of ecosystem can be really beneficial both for the client and then all of their partners. As we develop the overall campaign strategy, the messaging approach that we want to take, and that gets translated into all of these different channels, Joel is empowered to reach out to me directly, from Erupt to CORE, and talk about, there's this messaging component that we're looking at putting into paid search or into digital. We want to learn a little bit more about what the idea is behind it, because they might be able to interpret it in a different way than we've thought about it, that works specifically well in that channel. And that's not Joel going behind Stephanie's back to talk to one of the other people in the circle. It's us doing exactly what Stephanie wants us to be doing. She can be in that conversation, she can have her point of view in it, but she's really serving as that quarterback. She doesn't have to be the one fostering every single conversation. She's fostered the dynamic that encourages those conversations.
That's such a good point. I feel like you're reading my mind, because that was going to be my next question of, like, do you coordinate behind the scenes? And it makes me think that, it's not just that Stephanie's built this great scalable team of experts, but at the core of it, it's about trust, because she trusts all of you. That trust is then distributed amongst the team. And Stephanie, I'd like to go back to a little bit of our earlier conversation before I go to the next slide, but about how, when you bring partners into the fold, they're going to be working with these other people, that they're going to have to communicate without you, because you have other things to do, like in life, than just be the middle person of emails. Like, when you're vetting partners in that, like, what are you looking for, not just for your own expertise, but how they fit into the whole ecosystem?
Yeah, I think for us, the skill set at this point, when we do an RFP process, the skill set is sort of table stakes at that point, right? Everybody's going to have a certain skill set, and that's the reason they're at the table. I think for us, it's really about looking for a partner. We are very big about on our team about not talking about vendors. We talk about partners. And I think for us, we need someone, we need a group of people, and I'll like Mickey, to your point about the quarterback, we need a team of people, right? That at any given point fit in with us culturally and also with our other partners culturally. And so, there's a very different experience you get, Lauren, when somebody walks into the room as part of our RFP process, and they sit down and they pull up their slides, and they say, okay, we're going to give you our spiel today, right? Versus the experience you get when somebody walks in the room, sits down and says, across the table and says, let's talk about what you're trying to accomplish. Like, what goals are we trying to accomplish here? And what are we going to do in the next year? And those are two very different conversations. And I think for us, the latter really shows us, okay, who's in it for the long run with us, who wants to make sure that we're successful strategically, and who's going to be a good culture fit from a partner standpoint. So that's a big thing that we look at, not only when we're hiring internal people, but really when we're hiring our partners as well, because it's important to make sure that they can have those conversations without it feeling like there's a competitor in the room and they can't, collaborate effectively.
Yeah, there's something to be said for like that vibe check that you can't really quantify. It's one of those like, when you know.
Yep.
they're gonna mesh, or it's just not quite right. So thanks for going on that little detour. So let's go back to developing that trust, being able to communicate behind the scenes, openly, honestly, to get things done in service of the client. So these were your results from the campaign. Who would like to dig into the particular slide?
I can probably speak to it quickly, and then Steph, you can give us any updates on kind of different successes that you saw internally. Obviously, we can't draw one-to-one between the overall increase in vaccination and people's immediate response to what we put out in the market. But what we did see overwhelmingly was positive engagement and positive response to that empathetic and encouraging invitation we made to have that dialogue. We saw hundreds, thousands of parents reach out to have conversations, engage with the different campaign materials that we created. And over the course of time, it appears that there was a very strong correlation between the beginning of that dialogue and parents starting to make the decision to vaccinate their children and also to vaccinate themselves. There had been a staunch contingent of individuals who had been waiting to get vaccinated or who had been opposed. And we started to see some of those folks that were in that movable middle make progress as well.
Yep. I think from an internal standpoint too, this was the first campaign of this type that Arkansas Children's had ever done. We always have had a vaccine strategy, but to this scale and to this level of importance, it was the biggest thing we had done. And so from an internal standpoint, we actually moved our internal vaccination compliance as well quite a bit, which was great to see in the early days of, us trying to figure out what that looks like from an internal standpoint. So we had a whole internal campaign that Mickey and his team helped us. We took what we were doing externally and helped kind of pivot that a little bit to be internally focused as well. And frankly, the logo mark that you saw a couple of slides ago that said, let's talk about it, that was something we intentionally created with the purpose of having that live much longer than this campaign. So when flu season came around most recently, and just a few months ago, we used that same logo mark as part of a conversation in general about vaccines. So it really has given us a platform internally and externally to be able to say, we get it, right? This is a climate where you have a lot of questions. You're trying to make the best decision for your kiddo that you know how as a parent, and we want to be the source of truth for you. And when you have questions, we want to have a conversation about it. So it really has given us a platform, not only for this campaign, which we did, a year and a half ago, but it really has kind of opened that door for future campaigns as well.
Oh, that's really cool that the thing that you've built now has its own life, like separate from its impetus. That's amazing.
I feel like I always forget to make that point when we talk about that for that exact reason. This is the connection point between the strategic plan and then individual efforts, right? As a partner, we're given all of the information we need about what Arkansas Children's is trying to achieve long term. And one of those main pillars is around vaccines for children beyond just the COVID vaccine. So that was an intentional part of that. And I'm thrilled to hear that it's getting used much more widely.
Awesome. All right. Well, this amazing case study, great story, and I think probably fairly rare in our world that such a configuration has been built and has shown such success year over year. So I'd like to open this up to all of you and ask if you could give a marketer or a solutions provider partner one piece of advice or two pieces of advice, what would it be in pursuit of building a team like this? Each of you.
That's a good question.
Joel, we can start with you.
Lauren, I may have spoiled my own thunder a little bit, but I think for me it would be to be a partner, and I think that means being open-minded. I think that means changing the way you may have done stuff traditionally. You know, for us, again, I was coming into where I am now. I was used to an agency of record. It was different for me to sort of have all these moving pieces and figure out how to connect them. But I think also from the, you know, from the sort of solutions provider standpoint, you know, be willing to have that conversation without it feeling like, again, like there's a competitor in the room, right? I think if we can fully understand that we're all in it for the same success and the same reason, and we're going to win, we're going to succeed together, or we're going to fail together, right? I think that's what really is the key to making something like this work, is really making sure that you're being a partner, both internally and to your partners externally as well.
Sure.
I think from my perspective, two words come to mind: trust and push. And Lauren, you touched on the trust factor a little bit earlier, but you know, as a healthcare marketer, trust yourself that you are choosing the right partners to bring to the table. That earlier slide that we showed that had numerous different partners, I'm sure is extremely intimidating. But there's a reason that Steph has brought all of those partners to the table. Like, they are best in breed at what they do. But then at the same time, also push them to become better. Like, I know from our perspective, I know Mickey's the same way. You know, we're not naive to think that everything we do now is going to be the best a year from now, right? So always continuous to push on your vendors. If there's something you need, questions that you might have, things that you're hearing in other industries that could potentially be brought to healthcare, that's the way everyone evolves. So I would just be open and confident to be able to push on them as well.
And I think the one thing I would add specifically for folks inside of provider organizations would be that clarity is kindness. You know, be really clear about what you want and don't want, and what you need and don't need from your partners. That it allows them to focus on the things that they're uniquely good at providing. And when you have access to this greater ecosystem of partners and information, you have everything you need to do it to the best of your quality. It also empowers your partners to come to you with new solutions that are outside of what you've asked for directly, but you know that they're doing that on their own volition and not because they are misinterpreting what they're being asked to do. We always say that to each other internally at Core too. Clarity is kindness.
That's something we have in our core values as well. So when we talk about it a lot, and I want to go back to something that Joel said about pushing. I feel like, and also connecting it to Stephanie's description of like the vibe check. I feel like it's a red flag if you have somebody on your team, an external partner, that is content with checking the box and moving on. I know from our perspective, we want to be pushed. Our people appreciate it. They want the challenge. They want to be learning something new. They want to keep their eyes on the horizon. And if you have somebody that's not interested in that, they're not going to really be there. They're there for a reason, and it's a paycheck. So, you know, like that should be just an initial red flag if they're not down to be pushed and challenged a little bit. Anything else that you guys want to share before we officially open this to questions? All good. All right. Laura, do we have any questions coming in?
Yes, I do have a few.
Okay, great.
Here's the first one. We handle everything in-house with just a couple of service providers for very specific services. How can we get buy-in to outsource more services so we can stay strategic?
That's a good one.
Great question. I think my advice would be to start small. So start where you think you have the biggest gap. So let's say it's digital. And something I don't think we touched on yet, Lauren, but is relevant to this question is if you can start small, and even maybe with 1 or 2 campaigns, right? You don't have to go, 20 service lines. But if you can start with a couple of small campaigns, get your foot in the door with a good partner, a lot of times that partner will connect you to other partners. So, I know to the slide that we had earlier where it showed sort of our ecosystem of partners, a lot of those team members of ours, extended team members, a lot of them actually came from our partnerships with some of our other agencies. So I would say start small. Once you, as far as getting the internal buy-in, if you can start small, immediately start showing honestly the data, the results of what you're doing and the performance of your marketing, whether that be through leads that you're driving, hopefully appointments if you're able to show that. I think your leadership will start to see pretty quickly the value of having that skill set and having that additional workforce to help you. And you just kind of continue to build your case from there. So I would start with something that is a gap that I don't want to say quick win because I don't feel like there really are quick wins these days, but start with something that is an identifiable gap that your team maybe isn't able to fill as successfully internally that you'd want. Build that relationship again, even if it's a 90-day trial that you do with a partner for a campaign, and then build from there because a lot of times they can connect you to other partners in the same way that we've done with some of the people on this call, just to build out that network that you need.
I love that. And that goes back to the idea of trust and being able to communicate openly. If you have your existing partners already, identifying their friends of the family, so to speak, then like that's already built in. You don't have to start from scratch on making sure those folks are communicating properly. That's awesome.
Absolutely.
Anything else? Laura, any other questions?
Yes. How do you decide what services are best outsourced?
Ooh.
Good question.
Right, another great question. I would say it kind of goes to what we were just talking about. I think doing, start with a SWOT analysis or a gap analysis on what you think you can do internally versus what you can do externally. That was something that we did pretty quick when I started here, was to say, and at the time I was actually over the marketing technology team. And so it was, okay, let's look at who we currently have in place. And we did have some partners in place. I don't know that they were the most strategic partners at the time, but we had some partners in place. We sort of laid them out on the table and we said, let's do an analysis on which of these are providing value for both, whether it's a platform that you currently have, so web platform or, a marketing automation platform. Start with that sort of SWOT analysis view of where you think you really are getting benefit and where you're not. That will give you a good idea of where you think you need to pivot going forward. So that would be my recommendation, is just to start with that initial analysis. That'll help you figure out, if you've got a small team internally, and let's say it's on the digital side, you've got a small team, and you also know you have weaknesses in the digital marketing space, that's an area where you're going to quickly be able to see sort of on that grid that you need to be outsourcing pretty quickly.
Great approach.
Great.
Actually making a visual grid of what are we missing rather than just trying to kind of guesstimate like, well, it feels like this. No, yeah. I love that. That's a great tool. I love a spreadsheet. I don't know.
Same.
Laura, sorry, you were about to say something.
How do you determine the cultural fit for service providers?
I think the in-person piece is really important, if I'm being honest, which is different nowadays, right? We do a lot of things like this, sort of virtual, but I think being able to bring someone, especially if it's for a larger partnership that you want to establish, being able to bring them in person, you're going to get a lot different, as Lauren said, vibe check, you're going to get a lot different of an experience in person than you would even, through a computer screen. So for us, I really, I actually used a real example earlier when I said that. We had an experience with an RFP process where we were down to the final two. One walked in, pulled up a slide deck, and immediately started going into their sales pitch, for lack of a better way to phrase it. The other group came in, didn't pull up any slides, sat down and said, let's talk about what goals we're trying to accomplish together. And so I think being able to just see how they approach that conversation, which, it feels a little bit subjective, but you're going to, hopefully from your side, you'd have enough people in the room to be able to help you with that assessment and that vibe check. But, I think being able to see the way they approach the work that they do, of course, ask all the questions around, we ask a lot of questions around their company culture. So things like, how many employees you have and what is your retention rate? We ask a lot of those questions. We ask, what is our account team going to look like after this initial phase is over, right? Because a lot of times you'll get the best players for the RFP, but then you may get shifted to a different team from an account management standpoint. So I think asking that question is really important of what is our direct team going to look like on a day-to-day basis? How often will that switch? You don't want your account team switching out every 2 months, right? Because then you can't build any momentum or rapport with them. So I think asking them direct questions about their culture in that way is really important. But then also, if you can, getting some sort of in-person interaction before you formally partner with them is just really helpful to gauge sort of how they're going to interact with your team.
Yeah, and I would say from the partnership side of things, we appreciate that too. Because there's times that we meet with a client and it's like, oh, we can tell this is not going to gel. Like they have this expectation and this is more of our culture, and love your mission, work seems cool, but doesn't seem like we're going to get along like really well in the long term. So that's so huge. Okay, was that all, Laura, or do we have any more that came in?
Yeah, I believe that's it. And to everyone, if you do want to ask a question, you can still do so for the next minute or so. And we can get back to you if you have any other questions. So just let us know.
Sure. Yeah, and you have our contact information on the screen right now. So if you have any individual questions for any one of us that were on the call today, please feel free to reach out. And other than that, thanks so much to Stephanie, Nikki, and Joel. This is a great conversation. I love having it. I think that what you've built is really special and unique. And I hope that both folks on the healthcare, on the system side, and on the partnership side can get something out of it, because it's really, really valuable story to tell. So thank you for spending time with me to talk about it. And thanks to everybody online for spending this time with us to hear. And please reach out if you have any questions. That's all we've got.
Yes. Thanks so much. Thank you, Reason One, for sponsoring. And remember, there is a brief survey. So everyone have a great afternoon.
Thank you, Laura. See you all.
Thanks.
Bye.